welcome back to Native Roots Radio Presents I'm Awake, and this is Robert Pilot.
This portion of the show is supported by Native American Community Development Institute, or NACD, in Minneapolis.
Hey, we have Associate Professor William Mantyh on from the University of Minnesota to address and discuss some disparities and perspectives from our Native American communities in the research for dementia. I want to just say a big welcome and thank you so much, Will, for coming on.
Yeah, thank you so much for having me. It's a delight to be here.
Oh, well, welcome. Hey, I got a few questions here, and Haley and I were talking a little bit before you came on how interesting this is. And I know I'd love you to tell us, what is Alzheimer's and what is dementia? What are the differences, if there's any, or if it's words or what? And again, welcome.
Yeah, again, thanks for having me. Yeah, this is a really important question because even a lot of physicians still, it's a confusing term to say dementia and Alzheimer's disease because for the longest time they were used interchangeably. If you said someone had Alzheimer's, it was the same as saying someone had dementia. But from a terminology standpoint, you can think of dementia as an umbrella term. And so dementia is just a description that means that someone is no longer able to go through their day-to-day life on their own because of a memory and thinking problem. They now need help from, let's say, their loved ones or from an assisted living facility because, again, they don't have the memory or the functional status to get through their day-to-day life independently. And so you can imagine just dozens and dozens of things that can cause dementia. And Alzheimer's disease is the number one cause of dementia in general in the United States. If you travel to different areas of the world, that might be different. For instance, head trauma may be the leading cause of dementia, or a bug that infects the brain, like malaria, could be the leading cause of dementia. So, dementia is a descriptive term, and Alzheimer's disease is the leading cause of it, as far as we understand, in the United States.
Wow. How can you detect it? How is it detected? I know with my father, it was really interesting. We thought he was slipping into Alzheimer's. And then when he took a test, it was amazing that he had like a lot of recall. Like I remember his doctor asking him to count 100 backwards by threes, and he could do it. And I don't have Alzheimer's or dementia. I couldn't do it.
Yeah, so it is very difficult to detect Alzheimer's disease or a lot of the other types of dementias out there, especially if they're in a very early stage. And I think that's why, someone like me has a job, is because if someone, let's say, is in a very advanced stage, they can't remember what they had for breakfast, they can't recognize their loved ones anymore, that's a stage where it becomes pretty obvious that someone has dementia. But let's say someone forgot where their car was parked. I do that sometimes, especially if you're using a parking garage that you use the same day every day, or you forget the name of someone you just met and you think, why did I forget that person's name? And that's stuff that happens to everyone, and it happens more and more often the older we get. So it becomes really hard to diagnose dementia in the earliest stages because those could be the same symptoms for someone who's developing those early signs of dementia. So there's a couple different things that we do to try to untangle what's going on. The first thing is really just taking a detailed history and trying to figure out, are there red flag signs? Certain red flag signs that we hear about is if someone's getting lost in their own neighborhood and really turned around to the point where they can't even navigate home again. That's something that even if you're having a bad day or an off day, you should still be able to do. Or someone who's asking the same question over and over and over again, even if they're given ample opportunity to listen to what the response is. So those are red flag symptoms that, in my mind, kind of tell me that we're not just dealing with normal aging. So once we kind of collect that history and we're worried about someone, we do more extensive cognitive testing. And these are things that you probably have seen in the doctor's office, where we have people copy complex geometric shapes, or we have them remember a list of different words. And if things are worrisome or even giving us any evidence that this still could be early stage neurodegenerative disease, and that's just a fancy term for dementia, we do a brain scan, and the brain scan can also clue us in as to whether an underlying dementia could be present based upon what we're seeing with the size of the brain. We know that most of these dementias actually shrink the size of the brain. So we can get important clues from the MRI scan. And then finally, there are blood tests. And we almost always perform these blood tests because things like vitamin deficiencies, if you get from, let's say, not eating the right diet, or hormone issues, so thyroid hormone, if you don't have enough thyroid hormone, that can look identical to Alzheimer's disease. So we test for things that can mimic these dementing illnesses with a blood test. So that's sort of the standard way that we evaluate for dementia. But one new thing that we can talk about more if you're interested are new blood tests. So there are new blood tests coming out for these dementias, Alzheimer's disease being a type of dementia that we have a very good blood test for now. And these are really revolutionizing our ability to diagnose the disease in an early stage because they're about 90 to 95% accurate in someone who is still in an early stage of Alzheimer's. So these blood tests are really helping out quite a bit. But yeah, so that's our general kind of overview of how we try to diagnose these diseases.
Hey, before I bring Dr. Stately on with us, I just have one question. Is there a cure, and is it hard to, I guess it's two questions. Is it hard to diagnose Native Americans because of our life expectancy? And by the way, welcome Dr. Stately, Native American Community Clinic, to join in on the conversation.
Yeah, so the question about what can be done about these dementing illnesses, the first thing is I always use the old adage, an ounce of prevention is worth a pound of cure. If we can really intervene early on in someone's life with things like a healthy diet, with having access to educational opportunities, having a type of job where you're not dealing with chronic stress and all of the bad health consequences related to chronic stress. If you're getting regular exercise early on in your life, you can really make a big dent in your future risk of developing Alzheimer's disease, even for people who are genetically predisposed. And so prevention is really, I think, the most important thing. For people who, let's say, have Alzheimer's disease, we now have some drugs that can slow down the course of the disease, but these drugs are not great. I'm not going to sugarcoat it. These drugs have a lot of side effects, and they have overall modest benefits, and they only slow down the course of the disease. So they don't stop the disease in its tracks. Patients, unfortunately, can never expect to get better or get to where they were before, but it can slow down the progressive downward course of these diseases by a little bit. And it's about anywhere from 25 to 35% slowing. But these drugs are very, very expensive. They require an IV chair to sit in and get the drug infused through a vein every 2 weeks. And they don't work very well in people who have other types of dementias. In fact, if you've got another type of dementia, let's say dementia caused by strokes or dementia caused by heart disease, this drug is just not going to work at all. So Alzheimer's disease is really the only disease that we have a therapy now that can slow down its course, whereas all the other dementias, really all we can do is try to support the patient the best we can with things like physical therapy and occupational therapy, and trying to have them eat a healthy diet and have access to exercise and proper caregiving, treating depression if that's there, treating anxiety if that's there. But we don't have an actual drug to go after those types of dementias yet. Again, it's an exciting area because we are learning more and more about these diseases, but we don't have a drug yet for those other types of dementias out there.
Interesting. Hey, we have Dr. Stately here, President and Executive Officer at Native American Community Clinic, and we're speaking with Dr. William Mantyh, Associate Professor at the University of Minnesota Medical School. Welcome.
Yeah, thanks for inviting me into the conversation. I appreciate it. Hey, Will, how are you?
Good to see you again.
You as well. Yeah, it's been a few months. Yeah, I think one of the things I would wonder is so do the symptoms of dementia look differently for Ojibwe or Dakota people or indigenous people, I guess? Like how the expression of it, are there cultural nuances you need to look for? And those kinds of things. Those would kind of be important things for us to talk about. And I'm not sure, we're almost at the top of the hour here. Yeah, bottom of the hour, whatever we call it. So.
Yeah, I'm realizing that I missed that second part of the question. Sorry about that. Yeah, so our group recently published a paper talking about the distinction between hallucinations, which are kind of pathologized, and thinking, oh, this person's just kind of seeing something that's not there. It's all in their head. It's just kind of, you know, it's a psychiatric issue essentially.
Yep.
And distinguishing that from a normal cultural or a normal religious or spiritual experience. And so hallucinations are a pretty big deal in evaluating dementias, because certain types of dementias can lead to hallucinations more often than others. And so it can really clue you in as a doctor into what the underlying type of dementia is. And so when we ask our questions to our Ojibwe participants, are you having a vision of something that's not part of the material world? A substantial number said, yes, I have these spiritual experiences where I'm seeing something that's not part of the physical world. And a lot of physicians, if they would hear that, they would just say, oh, this is a hallucination, this person's having a psychiatric illness, and not think, oh, this is just a normal kind of spiritual occurrence. And I think, again, I'm definitely not an expert here, but there have, as you know, been instances in the past where everything associated with Native culture and Native spiritual practices has been pathologized, and people put in insane asylums. And we want to obviously make sure that that's not the case, and that people aren't being misdiagnosed either. So that is one thing in terms of the story that came up.
Yes.
We're here with Dr. Stately and Dr. Mantyh. We're talking about Alzheimer's in the Native community. We'll be right back after this short break.
Hi, this is Governor Walz. Thank you for listening to Native Roots Radio.
And we're back to Native Roots Radio presents I'm Awake, and this is Robert Pilot.
This portion of the show is supported by Native American Community Clinic on Franklin Avenue in Minneapolis, honoring health and tradition.
Yes, they do. Hey, we have a really interesting show going on here. We're with Dr. Stately, President and Executive Officer at Native American Community Clinic, and we also have Dr. William Mantyh, Associate Professor at the University of Minnesota Medical School. Welcome back, you guys. And Dr. Stately, do you mind taking over here on some of the questions? This is really a great conversation you guys are having.
Sure, not at all. Appreciate it. So I hadn't had a chance to read your full article today because I actually just got done with a 3-hour medical appointment with my kid. It was really quite challenging for my day. However, so one of the things I was thinking is like how can you give us an understanding a little bit about like how much impact that Indigenous people or Native elders have with respect to this problem? Like how likely are they to get it? And what is one of the things I heard you mention in the first session? You were talking a little bit about how, like, for a lot of the dimensions other than Alzheimer's specifically, there isn't any treatment that's curative or slows it down in its progression. And then you said prevention is worth a pound of cure, right? And one of the things I'm wondering is, like, one of the things I always think about is like the earlier you catch something, the more opportunity you have to sort of treat it, slow it down, and manage it better. So having access to care is probably also really, identifying it early, catching it early, and then having access to good resources to support. So kind of talk to us a little bit about what's available out there.
Yeah, so I'm sorry to hear about your kid. I hope that they're doing okay.
He's fine. He doesn't have dementia.
Yeah. So there was a recent publication that came out in the journal Alzheimer's and Dementia, and it was a group out of Washington University. University of Washington. I shouldn't ever confuse them with their competitors. University of Washington. And they did, I think, the best job so far at looking at what are the rates of Alzheimer's disease and related dementias. And related dementias would be things like vascular dementia and other memory and thinking robbing disorders. And they showed that the rates in Native populations were higher than in other racial or ethnic categories in the United States, and were substantially higher. And again, don't quote me on this. I don't remember off the top of my head, but it was something along the lines of 50% to even 100% higher than, let's say, the white population. So it wasn't just sort of a small statistically significant difference. We're talking kind of a categorical difference. And a lot of that dementia was termed vascular dementia. And vascular dementia is just a fancy term for when the blood vessels in your brain start to peter out or get damaged. And the blood vessels in the brain are very important because every human has about 400 miles of blood vessels in your brain. So your brain just is coursing with blood vessels, and your brain is very, very thirsty from a blood standpoint. It needs a lot of oxygen and a lot of nutrients. And so when you start damaging those blood vessels from things like diabetes or high blood pressure, head trauma also damages those blood vessels, high cholesterol too. That produces a lot of wear and tear, and you have a long period of your life where your brain is just basically undergoing wear and tear. And that is a period when I think access to care and good care is extremely important. Going back to prevention being much more useful than addressing the issue after the horse is out of the barn already. And so, yeah, I 100% agree with you, Dr. Stately, that things like high blood pressure, diabetes, high cholesterol, head trauma, those diseases of our blood vessels are happening for decades before the dementia shows up. And if we can get those under control in early life or midlife, we stand a much better chance of never developing dementia in the first place.
Got it. Is there any linkage to diet and dietary considerations?
Yeah, so there's more
environmental toxins, anything like that?
Yeah, one of the hardest parts about studying diet and environmental toxins is that there's just so many out there, and everyone has a different exposure to them. So running like a rigorous scientific experiment where you have, 2 humans and the only difference between one of them is the one thing that you're kind of testing. Let's say you want to test to see, higher intake of high fructose corn syrup, is detrimental to dementia risk. It's hard to test that because everyone eats a different amount, and some people have other components of their diet. So it's very hard to run like a good experiment. But at the same time, I think more and more data is coming out that ultra processed foods are not good for you, or foods with. I'm not an endocrinologist, so this is sort of the limits of my knowledge here. But with a high, what they call glycemic index, meaning that you take the food and you get just through the roof levels of blood sugar within minutes. That type of food is essentially not good for your overall heart and blood vessel health. And so having foods that takes longer to digest, where you have a slower release of sugar in your bloodstream, or foods that have, of course, other nutrients in them. Again, the ultra processed foods basically are just that. They're empty calories. They don't have really anything to accompany them that normally fruits, vegetables, naturally occurring foods do have that help your overall health. So yeah, I think there's more and more data out there that and food out of the ground is going to be better for you than something that you can't recognize anymore because it's been put through a machine and packaged.
Well, that's a really good segue into the next piece of this conversation, because I think one of the things that we recognize is that we are moving in a lot of indigenous communities, trying to reclaim our indigenous foods, have more of those things involved in our diet, trying really hard to sort of kind of go back to the traditional ways we used to eat. And hopefully we'll start to see in a couple of generations, we'll start to see some of these things slow down a little bit that are related perhaps to sort of like food related illnesses. But one of the things that I know is that there's been a conversation happening about how dementia or Alzheimer's is considered like the fourth type of diabetes, right? People having these conversations. And so one of our listeners just asked the question, what is the relationship between diabetes and dementia or Alzheimer's? And so my first thought was you definitely get vascular degradation and all kinds of challenges with diabetes long term, specifically with all those really high blood spikes and things like that. So there must be some type of relationship there. What's the science and evidence starting to tell us about this?
Yeah, so that term that Alzheimer's disease is sort of a different type of diabetes, it has a lot of validity. So there's actually a type of scan where we look to see if the brain is taking up blood sugar, and we know that people with Alzheimer's disease, actually their brain does not take up blood sugar as it should. And that's very similar to type 2 diabetes, where, let's say you're looking at your muscles. Your muscles aren't taking sugar in as it should. That sugar is just floating around in your blood vessels, but it can't get to where it needs to go. So that happens in Alzheimer's disease. I think one of the big questions, though, is kind of the chicken or the egg. What's happening first? We know that there's a lot of things that go wrong in Alzheimer's disease. The ability to absorb sugar from the bloodstream is definitely one of them. But kind of an unanswered question is how much is that a cause of what's happening, as opposed to how much is that a byproduct or kind of an end product of what's happening. So that's a little bit uncertain still. But again, there's a lot of validity to that term, kind of a different type of diabetes, or type 3 diabetes, I've heard it called before. But the question specifically about how diabetes affects your risk for dementia, you pretty much summed it up perfectly. So type 2 diabetes does damage those blood vessels. Again, your blood vessels are not happy when there's very high levels of sugar. So those sugars actually change the composition of proteins that are in the blood vessels. And when that happens, the ability for blood to bring nutrients into the brain, to bring oxygen into the brain, to have the normal elasticity that your blood has with each heartbeat, that goes away with diabetes. And as I said, your blood vessel has 400 miles. I'm sorry, your brain has 400 miles of blood vessels, and really needs good blood vessels to feel healthy and to allow us to think and remember things well. So it's kind of this wear and tear process over time that, again, leads to these dementing illnesses. Yeah.
Wow, that's fascinating. I'm looking forward to where the research will go in the future around some of this. It'll be really interesting to see where that happens in 5 or 10 years.
Yeah, no, definitely. And it's really thanks to, one thing I wanted to mention too with this research is, I'm really just a researcher and a doctor, and it's really thanks to people like Anna Marie Hill, who I think you had a chance to meet, Dr. Stately, who's a member of Red Lake Nation, and Neil Henderson, who's a member of the Choctaw Nation of Oklahoma, who really kind of allowed me to open the door and partner with the Boys Fort Band of Chippewa. And they're the ones who are really driving the ship and who own 100% everything of what we're doing, and who have the community advisors telling us what's important to focus on and what are things that are not important. But this issue of diet and diabetes and memory loss among elders is a really pressing problem, and one that I've been really grateful to be a part of, because it's really rewarding to feel like we're bringing new information that can hopefully help in the long run.
Nice.
Wow. Well, this has been amazing, Dr. Stately and Dr. Mantyh. We got to do this again. This is unbelievable information. We have
I have so many more questions that I want to ask. So.
Yeah, I'd be happy to be back. Thank you for having me. It was, like I said, a genuine pleasure to see you again, Dr. Stately, and
you as well.
Thanks for having me, Robert and Haley.
Yeah, definitely. Wow, we can try and set up another meeting, because this is really unbelievable information, and it sounds like you're really in the cutting edge of what's happening. I want to just give a big shout out and a big peeny gigi thank you for coming on. And Dr. Stately, I know your life is full, and I appreciate you coming on and helping out with this interview.
Absolutely. Thank you for inviting me. And Will, it's always great to see you. Hope we can spend some time together again in the near future. And you guys are doing amazing work. So on behalf of the community, thank you so much. Chimigwich, Binigigi, Yamya.
Congrats again on the Bush Fellowship.
Thank you.
Yeah, Miigwech for having me here. It was a pleasure.
Absolutely.
Right on. Hey, this is Native Roots Radio, and we'll be right back after this short break. Stay with us.